Health, or IMH. AIM is a nonprofit organization with the mission to provide access to whole person health and wellness in greater Washington, D.C. area through integrative therapies, education, and research with a focus on vulnerable and low-income communities. Please sign up for our mailing list at healthaim.org. Follow us on Facebook at facebook.com AIM Health Institute or Instagram. And consider donating to help us keep going and access more people. GWOIMH provides professional development, education, and community outreach to improve health and wellness. And you can follow GW Integrative Medicine on Twitter, Instagram, or LinkedIn, or sign up for our newsletter by visiting our website, smhs.gwu.edu/OIMH. AIM and GWOIMH are very happy to offer this experiences for free and plan to keep doing this going forward at Fridays at 2 p.m. Eastern Time. And in a second, Janet will tell you why we're doing this today on Wednesday. And we'll look forward to continue to be present with you each week. I'm Misha Kogan, founder and executive director of AIM and faculty at GW University. And together with Janet, we're co-hosts. And this week is my week to be here. And Janet, say a word about yourself and this Friday.
Hi, I'm Janet Rodriguez. I'm the Administrative Director for the Office of Integrative Medicine and Health. Welcome. See a lot of familiar faces, and we're glad to have you back, and hopefully we'll have some new folks come in. The reason why we're doing this event today is because on Friday at 1 p.m., many of us will be at the Sung Symposium, which is a free online event. The focus of this event is wellness and longevity. I put the registration link in the chat window so you can go and copy that and then paste it on your URL. And I'll turn it over to Dr. Kogan now.
All right. And our guest, and more than a guest, is really part of AIM team as a medical director, is Amy Kossoff, and I'll have Amy introduce herself. Amy, go ahead. Make sure you unmute yourself.
Yeah, I'm Dr. Amy Kossoff. I am the medical director of AIM, and I also have a small practice in Bethesda where I do integrative medicine, hypnosis, and acupuncture.
And
here.
And Amy has two absolutely stunning little dogs.
Three,
that sometimes tend to bark a lot. So if you hear that in the background, it's okay. It's as I like to call it, it's a strengthening for your meditative practice when you hear a disturbing noise in the background. It's only enhances what you do. So we're gonna open up today with pretty interesting specific COVID-19 topic. And again, those of you who would like to start putting questions in, go ahead. It's you can put in questions at any time and then we'll address them as they come. So I'm actually gonna do a couple of things. So first I'm gonna share my screen with everyone just for a minute or two. I'm gonna put this recent article in New York Times up on the screen so that everybody can see my reference point and why I want to discuss this. So this is published in New York Times, I think yesterday or today. This is a very recent article, and a couple of days ago, April 20. And this is presented by an intensivist physician who worked for 10 days as volunteer provider at Bellevue Hospital in New York. And what's really fascinating about this article is, something that I think some of the clinicians on front lines have been observing now for some time, and that is that patients with this disease, when it hits, come in quite often not presenting as sick as they actually are. So they would come in with not a lot of complaints. They'll have some shortness of breath, but they will not say that it's severe. They will have some fever, but not very bad. And then in a matter of a couple of days, the disease rapidly progresses. What turns out is that majority of those patients who come in with some of breath, even if they're mild, have surprisingly very low oxygen saturation. So oxygen saturation is actually one of the key vital signs. So it's a parameter that is checked by equipment called pulse oximeter. And it looks at how much oxygen is present in one's blood, literally. And it's checking, it's typically on a finger. Some more advanced pieces of equipment can check pulse oximeter through putting the pulse oximeter on the ear. But in essence, the normal pulse oximetry is considered to be 95% and above, and it's not unusual for this disease for patients to present to emergency room with oxygen in the 80s or even lower, which in the past thought to be not compatible with life. So meaning that once oxygen goes less than 90%, majority of situations, not only does it require oxygen, quite often it's basically a pretty severe emergency situation require intervention immediately. So the fact that this disease leads to a very quick drop in oxygen saturation and quite severe drop is quite unique to this disease. There's not a lot of diseases that do that. It also is interestingly gives a very interesting opportunity to allow us to capture this early. And here I'm going to do something which is not usually we've done before. I'm actually going to go on Amazon.com and share it with you. And please understand, I have nothing to do with Amazon. It's just easier and they have nice pictures. You don't have to buy anything on Amazon. But so this is what you're seeing is a different pulse oximeters that are commercially available. And you can get one of those in just a couple of days. They range from anywhere from like $20, $30 upwards, maybe $50, $60. You're seeing two numbers. Let's pick A1 has better picture. Let's pick this one. Again, I don't know specific. I just picked. So you can see that this SpO2%, that's an oxygen in your blood, pulse rate, and that says 78 there. So the normal oxygen would be 99% would be wonderful, of course. Once it starts going under 95%, especially if it starts going under 90%, that's when you really have to be quite aggressive at saying, I shouldn't be home, I should be going to a hospital. So this is actually, I'm literally advocating for people who are very concerned and in a high risk category to have this little device at home. Why? Because if suddenly you start having any symptoms and with those symptoms, you also notice your oxygen goes down, that's probably in this scenario means you have disease and it's not just very mild, it's probably progressing. And if you Janet we will send you all at the end of the call, we'll send you the link to New York Times article that's quite easy to read. Okay, so let's go back here for a second so you can see some other options. A lot of the problem right now, I think, with a lot of supplements and equipment is that tons of things are on back order. It's not clear when you're going to get it. And so, like, for example, this seems to be like a cheap piece of equipment for $22. And it's probably not immediately available. So here it says that you can get it, but you can get it in a couple of weeks, not immediately. So, you know, you need to use your own judgment. Now, some of this equipment is FDA approved. That's the usually one I recommend purchasing. Right now, I'm not seeing any of them being FDA approved because the probably FDA approved are all sold out. So there is some risk that the equipment you're going to get may not be actually quite accurate. So that is a concern. So if you can get this from your pharmacy or supply store, that probably would be quite better.
Hi, everyone. My name is Elizabeth, and I am part of the team here. I actually personally had pneumonia a couple weeks ago, and a friend who had COVID lent me.
Okay, so I'm going to stop.
Pulse oximeter.
Perfect. So can everybody see Elizabeth? Can you speak up again so that people can see?
Sure. Sorry. So my name's Elizabeth, and I'm part of the team here for AIM and the Office of Integrative Medicine and Health. Personally, I actually came down with pneumonia a couple weeks ago. A friend who tested positive for COVID had already purchased this and lent it to me at that time. So thankfully, I tested negative. But as you can tell, it's extremely easy to use. And was very reassuring, you know, even though I had a high temperature, my oxygen was still within range. So right now it's 98. You can see is very easy to use. And this one is called ZAC-V rate. ZAC-V rate. ZAC-V rate. I honestly can't read it, but is very not sophisticated technology, but very easy to have.
Very good. Thank you, Elizabeth. And I'll show you the one that I use professionally. This one is, by the way, also not FDA approved. And it looks very similar to what Elizabeth's showing. There's just one button, you turn it on, and it tells you the pulse and the oxygen. So, you know, the only reason I give disclaimer about FDA approval is that practically we should be recommending FDA approved pieces, but reality is such that they're a lot more expensive and they're much harder to find, especially right now during the pandemic. But you know, and that's not before us by CDC. I have not seen any CDC recommendation regarding this. And so here I'm going to sort of venture out of that category and say I believe that anybody at high risk category should be obtaining this piece of equipment. So that is all I personally have for today. In part, I want to give Amy more time, and also I want us to have a good amount of time for questions. So let's see if anybody posted any questions. Next meeting info from Cecilia. We'll send that early next week for next Friday. So the next meeting will not be this Friday. It'll be next Friday at 2 o'clock, which is May 1st, is it? Am I right about that? Yep, it's May 1st at 2 o'clock. So we'll make sure that we send it to everybody.
A general request, if anyone who's not speaking could just please make sure they're on mute right now. Thank you.
Okay, very good point. Thank you, Laura. I'm gonna I'm gonna put the link to the article in the chat in a second.
So do we have any general questions for Dr. Kogan? At this time?
That's a good one. Dr. Kogan. Dr. Kogan.
So the question we have is, can you please address the recent reports about skin rashes as a COVID symptom?
Skin rashes as a COVID symptom. Ooh, I don't know. Amy, any thoughts on that? Amy forgot to tell us that she did tell us she has a practice, but she's an internist and probably has better answer than me for this.
Oh, I mean, I haven't heard any reports.
I haven't heard about that.
Sorry.
The person who put that question, do you want to speak for a second as to sort of why you put the question and what was the sort of where you got that information from? Diana, is there any, like, where did you get this information?
Okay, so I did not raise that question, but I have had some rashes, and on Sunday there was an article and a report from ABC News about this. And so I contacted from the American Dermatology Association. They've set up a website, a registry of things. I did have a video appointment with my Kaiser doctor first thing on Monday. I'm monitoring, I'm watching it at all. So there is some information about it, but it's just in beginning stages. Anyway, just for those people who are interested. I'm not a doctor, not in the healthcare field.
Okay, well, thank you. I guess we're gonna have to stay tuned on this one because I'm assuming there's gonna be more and more data if this is something that's gonna be observed, but it's probably not something very common.
I think it was shown.
Linda Blazer sent me a private question, but oh, go ahead. Dana, go ahead.
I was going to say that I saw the information and the reports came out of the Italian experience, but they've been only promulgating that information in the States very recently, that doctors were seeing skin rashes as a COVID-19 symptom.
Well, so I guess stay tuned. I would say it's probably very unlikely for this to be the only COVID symptom. In contrast, let's say the loss of smell as a very early COVID symptom seems to be pretty common even before fever begins. But interesting point. So I guess we'll have to revisit this issue. Thank you. Homework. Stay tuned next Friday. If I'm not here, I think next Friday, but we'll try to communicate if we find anything with our medical expert next week. So I want to go back to Linda's question because it was a really good question. So Linda asked privately for some reason, not for everybody to see, but I think it's okay if I describe this. So the question was, so if most of the problems with COVID, serious problems, are related to low oxygen or hypoxia, can we use the pulse oximeters to decrease risk of progression and minimize risk of ventilation? That's exactly the point. So the point is to try to catch this early with the idea that if we implement treatments early on, that there's a less likelihood to end up being on a ventilator. Now, I don't think there's a very clear evidence for that. If there would be, instead of sharing New York Times article, I'd probably share with you something more evidence-based. But nonetheless, I personally feel there's lots of integrative methods that probably can slow down or even arrest the progression early that have not been heavily discussed in the media, but we have covered some of them on this call. So it'll give you more tools and more, well, not tools, but more incentive to engage more aggressively in prophylactic measures quickly, or quicker, I shouldn't say quickly. And so it's basically I guess we would call this secondary prevention. So we would, once disease starts occurring, we try to prevent the complications of this by early assessment and raising the flag of severity of illness before the symptoms are becoming obvious. So, very good question, thank you. So let's take a couple more questions, so then we will move on to our mind-body components. So let's see, there are other questions. Do you agree that scaled up testing is needed before reopening the economy? Oi, political questions. Oh, good God. If so, what kind of testing COVID? Okay, so COVID-19 nasal, absolutely not. That test should not be done on asymptomatic patients. The nasal swab sensitivity is about 65% in the presence of high symptoms. So at the peak of symptoms, it means that in asymptomatic patients, sensitivity of this test is less than 50%, which makes it as a screening tool useless. The screening test needs to be somewhere about, preferably over 85% sensitive for it to be useful to test the entire population if you're trying to decide when to reopen the economy. So we don't have an answer to any of this because antibody tests are available, FDA approved. We have no idea what they mean. We don't know if that means somebody is immune. All we know, they've probably had infection, but we don't know if they can get the sort of a green stamp of, okay, you can go out and you're fine, or it means, we isolate you? We don't have any answers. So I don't have any good answers to these questions, which are critical questions, obviously, from political perspective, but I don't think the science is there to answer them at this moment. The best test I'm aware of currently is a spit test, which just got FDA approved, I believe, last week or maybe even this week. I think last Monday, so a week ago, just over that. And I believe that they already started implementing it. And it's a direct-to-consumer. You don't need a doctor. It's volthealth.com. So I'll just type it up here. So you can look that up. It's unfortunately cash. It's not insurance reimbursed yet. Volt Health. And they mail you a little tube. You spit in a tube. You mail it back. This test has much higher sensitivity even if you don't have symptoms, but it still cannot be used for population in general because we don't know exact sensitivity of that test either. And so unfortunately don't have an answer to that. So I think if there's, maybe we'll take one last question and then move on to the Amy's point. So Katharina asking, considering the new developments of virus being more like altitude sickness and sudden drop of oxygen rather than pneumonia, are there medical treatments? Exactly, no, they're not. None of these drugs are appropriate for this. It's been a recent study just been published that from Veterans Affairs Hospital showing hydroxychloroquine increases mortality and does nothing for this disease. Azithromycin, I can't even fathom why would anybody use it unless there's a suspicion for secondary pneumonia. The only thing I can think of to be used is some of the natural methods which we discussed already. I think the vitamin C, especially high dose vitamin C intravenously, has known to be effective against as a signaling to boost the immune system. As altitude sickness treatments, I don't think we have any, really. I mean, there's been testing done on hyperbaric oxygen. I'm not sure where that stands at the moment. So I don't think we can recommend that either. So unfortunately, no good answers. So let's pause on this question. And then if we have time after, we'll come back, starting with Laura's question about, I know COVID varies from lots of symptoms to no symptoms. So we'll start with that question when we come back. So Amy, to you.
Okay. So I am going to do a hypnosis. For those of you who have never had hypnosis, it's a state in which you become very relaxed and your conscious mind kind of makes way for your subconscious, and it's really your subconscious that is paying attention to what I'm saying. This is not, you can come out of a hypnotic trance whenever you want. It's not, you'll never do anything that you wouldn't do in normal life, just for those who might be a little concerned about hypnosis. I always get questions about quacking like ducks. So what I'd like everyone to do is just sit back, lie down if that's a possibility, and just start to take some deep breaths in and out through your mouth or nose, whichever feels best to you. Just breathing in and out. And letting your eyes close as soon as you feel like you want them to close. Continuing to breathe in and out, and in and out. Just imagine that you're sitting under a waterfall with some soothing water just pouring over your body at whatever temperature you like, making you more comfortable and more relaxed. Allowing the water to fall over your head, covering your body and down to your toes, and just feeling enveloped by water while you continue to breathe in and out and in and out. And your muscles will start to become relaxed as you breathe. Start to feel the muscles in your feet and your toes. There's so many muscles in your feet and toes, and you're going to feel a warm energy in those muscles, causing them to feel more and more relaxed. And feel that energy moving up into your ankles and your calves, with those muscles relaxing into your thighs, into your buttocks, and into your belly. Feel all the muscles being surrounded by this intense warm energy and just feeling more and more relaxed, almost as if they're just falling into the chair or the bed, whatever it is you're sitting on. Now feel that energy move up through your chest, down your arms, and into your fingers. You may even feel a little tingling in your fingers as the warm energy moves there. And keep breathing in and out, in and out. That's good. Now feel that energy moving into your neck. All the tension that we all hold in our neck falling away up into your face. All the muscles of the face, those muscles around your eyes and mouth, your jaw, which can become very tense. Feel those muscles relaxing. Even your scalp. Feel your scalp almost falling off the bone. It's so relaxed. That's good. Just continue to breathe in and out. And now I want you to imagine a hill. And at the bottom of the hill is a place that you find to be beautiful, whatever that might be for you, possibly a beach or a forest, whatever it is. We're going to go down a wooden staircase with 10 steps. I'm going to count them for you. Down the first step, going deeper and deeper into hypnosis. Step 2, feeling more comfortable and calm as we go deeper. On to the third step, breathing and relaxing. Down the fourth and on to the fifth, going deeper and deeper. Feeling yourself relaxing and feeling calmer and more comfortable. Sixth step and seventh step, deeper and deeper. 8, 9, and then down the last step. And here you are in this beautiful place. You can look around and see blue sky, the sun is shining. The sun itself is an immune booster. And you can just feel your immune system strengthening as you lie there in the sun, looking around at the beauty and the blue sky. I'm going to pause for a minute to just let you enjoy the scenery. That's good. And now we're going to get up and just take a little walk. And as we walk along, we see a building, a small building. And as we get to that building and walk inside, there's a cushion on the floor that might have a back or not, depending on what you need. And it has beautiful windows and flowers. And there's candles all around. And it's a place that makes you feel, as you go inside, so safe and secure. It's a place where you can sit down and think positive thoughts. Try to focus your emotions on positive things with everything that's going on around us. Because again, we know that stress is not good for our immune systems. And being able to focus on the positive is so helpful. And you can do that. As you sit there, allowing the sun coming through the window, the earth underneath you, and gravity to nourish you, you begin to understand what you can and what you can't control. And in times like these, we have to think about what we can control. And we need to let go of what we can't control. We can control what we do to boost our immune system. You can go outside, you can be in the sun, you can exercise and eat healthy anti-inflammatory foods. So many things that you can do and you can control. The positive thoughts that you have affect the cells in your body. We know that. We know that the mind and the body are intimately connected. And as you sit on your cushion, think about that for a little bit. Practice the pause. Realize that nothing is permanent. The one given is change, and that we will not be here where we are in this pandemic forever. And I'm going to pause for a minute and let you just think about those things as you sit and breathe. That's good. Just realize that we are all far from helpless. During this time, it sometimes may feel like things are spiraling out of control, but that's not true. Again, you just have to understand what you can control and what you can't. You're far from helpless. You can continue to focus on the positive. Do what you have to do to stay healthy. Because the better you feel, the better you heal. And that's important to keep in mind when we're healthy and also when we're sick. And you can imagine, perhaps, what's going on inside your body, where there are countless immune cells, a veritable army of them, working at all times to protect you, trying to clear your body of any and all viruses, including COVID, trying to keep your body in the best possible shape that they can. All those cells are working when you're awake and when you're asleep, day and night. And you can just visualize what's going on inside of you as well as outside of you. Again, none of us can predict the future, but we can control how we react to the present. So continue to breathe in and out and sit in this beautiful room where you can feel safe and secure. And know that you can come back to a place like this anytime you want. Because hypnosis is something you can do yourself. You can just start breathing and start visualizing this place where you are now. And you can find yourself here. It never goes away. You have the power to take yourself here any time of the day or night. I'm going to pause again for another minute and just let you breathe and enjoy your feeling of safety and warmth. That's good. So now we're going to get up and we're going to walk back the way we came. We're going to walk out of the house, down the path to wherever we were, the ocean or the forest. And we're going to begin to come back into the real world where we live. So I'm going to count from 10 down to 1. And when I get to 1, you'll open your eyes and you'll feel refreshed and strong. And you'll remember everything that I said during this session. 10, 9, 8, 7, 6, 5, 4, 3, 2, and now your eyes can open. 1, and here we are. Everyone feeling awake?
Thank you, Amy. Not really.
Right.
I bet some people on a call took a nap.
In the normal world, I would say to people, don't get in a car for a little while, but I know nobody's doing that anymore. So.
All right. So maybe before we go to questions, if anybody wants to comment how they feel or. Later.
I enjoyed it very much. It's very good.
That was great. I kept saying, no, I'm not hypnotized. I'm not hypnotized. And then at the end, by the time I was waking up, I said, I think I might have been hypnotized.
Well, you can always fight it if you really, really want to, but usually it becomes like, why bother?
Oh, it was so great. It really was wonderful. I wasn't consciously trying to fight it. I just didn't really think it would happen.
You're always totally, the thing about hypnosis is you're very, very alert.
Yeah.
So I mean, I think some people say, well, I wasn't hypnotized, but you know.
Mm-hmm.
We have a question asking, what is the difference between a guided meditation, hypnosis, and insight time?
Well, in a guided meditation, although you're kind of focusing more on, although you're listening to the meditation, the goal is kind of to clear your mind of thoughts. Whereas during hypnosis, I think of kind of meditation as something where you're not focused as strongly on what the person is saying, even though when you're listening to a guided meditation, you are listening to that, but it's more of a kind of a silent practice in which you're just trying to kind of quiet your mind. Hypnosis is a state in which you are really focused on what's being said. And what was the other thing?
No, that was it.
Oh. Anything to add to that, Misha?
No, you're the expert on this. So let's go to the questions, and we'll just keep going, I guess, until we address all the questions or time runs out. So I think I said that we're going to start with Katerina's question, considering the newer development. Did I address that? No. Considering the newer developments of the virus being more like altitude sickness and sudden drop in oxygen. Oh, no, I think I answered that already, right? Basically, question was medical treatments currently prescribed to resolve And what is your thoughts on, okay, yeah, I think I addressed that. So the next question was, Dr. Klinghardt says it's critical for zinc. Yeah, so this is a great question. So the question gets to the matter of the fact is how does hydroxychloroquine works? And the original idea was that as an antimalarial, it does something to the red blood cells to improve oxygen carrying capacity. However, myself included, there's a lot of people who think that actually hydroxychloroquine is nothing but a booster of a zinc, that the zinc can get carried into the tissues better. That's probably more accurate. That's how I feel. I don't think it is really appropriate for this drug to be used as a booster of a zinc delivery, given that it's highly toxic. So probably just a regular high dose zinc would be more than sufficient in terms of the delivery of zinc. So I don't think there's any study to say that if I give someone zinc with or without hydroxychloroquine, that somehow we know the answer which way it's going to work better. Without that, I would definitely vote with zinc alone. So to help with the homework, thank you, Dana. So we'll look that up. You send us the link to look up the rashes. So let's move on.
Misha, what's the high dose zinc?
Well, that's a good question. So if you get prescribed zinc by a healthcare provider, it's usually zinc sulfate, which goes anywhere from 220 milligrams up to 440. The issue is, though, that's a very inefficient delivery system. It's a medical grade zinc that actually has somewhere around 50 to 60 milligram, if I'm not mistaken, of elemental zinc. And you can get zinc gluconate, citrate, and there's some other forms, like my favorite form is chelates. Those are a little harder to find, zinc chelates. So those are almost purely elementals. So probably 100 milligrams a day of elemental zinc is really enough. I often give anywhere between 50 to 100. And one caveat, you don't want to take zinc indefinitely without taking some copper, so you want to be careful. But if you take it only for a few months, it's a pretty safe intake. Okay, so I did not address above question after all, so let me go back up and find. Oh yeah, Laura's question, right. I know COVID varies from lots of symptoms to no symptoms, but can you talk about the progression of symptoms to expect? Okay, so that's a really critical question. The typical early symptoms are often hard to distinguish from regular flu, except that it's thought to be that there are certain unique features. So loss of smell is one, it doesn't really happen with flu. And then early shortness of breath and early drop in oxygen or hypoxia. So those are the two critical ones. You know, and that's really the point. Most of the people who have severe disease, severe COVID-19 disease, really managed just for hypoxia. Other symptoms of COVID-19 tend to be not requiring aggressive medical intervention. The problem when hypoxia becomes severe and prolonged, it starts affecting other organs. So people develop what's called ARDS, or acute respiratory distress syndrome, and that progresses to sepsis-like picture. What's not clear is what exactly to call any of those states, because there's a lot of concern that hypoxia is not necessarily related to the oxygen lung capacity. It's more related to the hemoglobin oxygen carrying capacity or some other pulmonary. It's pretty complex conversation to have, actually, and I don't think it's been worked exactly all the details. The bottom line, you're really looking for progression of need for oxygen. And that's why we were talking today about getting the early measures as an indicator, even before someone can get short of breath. That's what's found to be quite amazing in this condition. People would be in an emergency room or in a hospital with the oxygen being less than 90%, and yet they're still talking on their cell phone and not really feeling short of breath. And that's very, I would say that there is no other disease that I've heard do that. And I don't know, Amy, maybe you have you've been practicing longer, maybe you have a better idea, but I have not seen anything that does this.
Me neither.
Yeah, so that's a unique feature of this illness. I mean, but you know, there may be some illnesses we're just not familiar, like malaria and some other things that we just don't really see in this country. So maybe there are some other illnesses that behave similarly. Okay, so thanks, Laura, for reminding me to address that. We answered Kathy Bell's question. And let's see if there's any other questions. Okay. Laura, did we answer your question? My question was on. Yeah. Why don't they give oxygen in early stages? They do. They give oxygen to everybody in early stages. So once you end up in a hospital, in emergency room, the moment they notice that your oxygen saturation is dropping, you're going to be put on typically just a nasal cannula. And then as disease progresses, if you're not responding, then it'll be escalated. It'll be a mask, a high flow oxygen, and then et cetera. They're a standard progression of oxygen supplementation. And in fact, in a lot of hospitals, they're now starting what's called a COVID-19 floor. And basically it's just the ventilatory support, not necessarily with the mechanical ventilation, just from oxygenation improvement standpoint. Okay, next question is, have had a blood clot, DVT in the past. Does the new clot issue make me more risk? That's a great question. I don't know the answer to this question. I know that in COVID, there is a much higher percent of thick blood being thicker. If you are currently treated for this clot, I would say you're probably partially protected. So if you're being given blood thinner now, that probably addresses this. But I don't know if this issue alone increases risk of you getting COVID. I would say probably not. It may be increasing risk of complications, but it should increase risk of getting it, I would think. But I don't think I can be definitive with this. Okay, Stacia is asking, I want to make sure I understand correctly. When oxygen falls to under 90, time to go to the hospital or time to do what? Yeah, so I've heard today from somebody that actually in New York, what they do is if they measure your oxygen in an ambulance and they measure less than 94, they take you to the hospital. I'm having problem with that recommendation because 94% is right at the cutoff of what's considered normal, which is 95. So I'm not sure 1 point under normal is really, but bottom line, absolutely. If the oxygen is less than 90%, you don't want to be in a house because you don't have a way to fix this at home unless you, and even if you have an oxygen machine somehow, I would say that's probably worth to be in a hospital to get potentially more aggressive treatment. Okay. For zinc, no, I don't necessarily recommend to take zinc chelate. You're not going to find it. Zinc chelate is a nutraceutical grade. So just whatever zinc you find, just take that. It's fine. Don't worry about copper unless you take zinc for more than 6 months. You're not going to get copper deficient in a certain period of time. How many days can you be on a ventilator without? Oh, yeah, I'm not going to answer this question. It's too complex. It really depends on the personal situation. And bottom line, people are, in our hospital, people are now on ventilators for 2-3 weeks. So it's not easy to answer that question. Should we all take baby aspirin for prevention? Absolutely not. There is no clarity that aspirin for this specific condition is doing anything because it's not, it's a different type of thickening of the blood. It's actually what they use in the hospital is heparin. I don't think aspirin for this problem is going to work. It's not a platelet hyperactivation problem. It's a D-dimer issue, which is a marker for complement. It's basically different types of coagulation. I don't think the aspirin is going to fix that. At least that's my understanding. And Amy, feel free to chip into that. But
yeah, I think you're right.
Yeah, so Linda, I'm not going to answer your question because there is no answer to it. It's impossible to answer that. I mean, some people on ventilator for months and months and are surviving after, and some people die after 3 days. So there is no way to answer.
Okay, I'm sorry, everyone. We're going to have to wrap this up. Dr. Kogan will answer any remaining questions via email. So thank you for coming. I hope to see you Friday at the Sung Symposium. If not, then next Friday, which is May 1st. And be well, be safe. Thanks for coming.
Thank you.
Bye, everybody.
Thanks. Bye, everyone.
So much for all of you.
Thank you, Dr. Kogan. Thank you.
Bye, Monica. Emmy, stay on.
Thank you.
Thank you so much.
Very helpful. Thank you.
Thank you.